Hello, good evening. And the disclaimer. That is the images which will be displaying or explaining during this medical session, they are purely for educational purpose. And yes, these images, they are not suitable for audience of all ages. They are displayed over here only for the mature audience and for medical education. So let's start with our today's session. Welcome to session 21. This is for suprarenal glands and chromaffin system. Yeah, 2 days they were a bit upsetting, but happens. Okay, so let's start with our today's system. Now the interesting part is, let's see suprarenal gland as such, right? It's a very small gland, but its importance is enormous. So today what we'll be doing is, because topic is short, right? So we'll try to cover it in such a way. Yes, for the senior students, they'll be knowing these things very well, but we'll be starting from hypothalamus, then we'll be watching what exactly is the sympathetic parasympathetic, then what are the paravertebral ganglia, what are the prevertebral ganglia, then we'll be going for sympathetic chain, then we'll see that what really happens in case of adrenal cortex, medulla, why this adrenal gland is like a superlative gland. That means it will act as a conventional endocrine system. Also it will act as a neural system or the part of the sympathetic nervous system, and we shall touch even the receptors, that is those muscarinic receptors or nicotinic receptors, alpha 1 2 beta 1 2 3, etc. Right, so it just to give you the complete idea about why this gland is so important. Because thank you. Yeah, regarding physiology, I will come to that. But so what I was telling, yeah, that so many diseases, so many pathologies, they are associated with this adrenal, right? So we will even talk about it. I'll try to simplify the things as much as possible, and most important is that yes, there would be few words, right? So that's why I was forced to keep that disclaimer, right? Okay, because today's session and tomorrow we'll be discussing diaphragm, and immediately all the next 6 or 7 sessions, they are purely for pelvis, perineum. So over there, so yes, we'll be discussing everything, right? And yes, it is needed. So anyway, because this is like an open thing, but yes, I'll tell you later on in detail about what really happened. Okay. But yes, I appreciate your support, because I got so many mails, so many ideas, and your support was phenomenal. So thank you so much. Okay, so suprarenal, right? Suprarenal, simply because of its position, because it is sitting on the head of kidney. So that's why suprarenal, aka also known as adrenal glands, right? So that is, this is like, say in adrenal glands, two, three things are very typical. One, the nervous, the blood supply. Blood supply is actually very artistic, and we shall have some amazing images when you'll see that, right? And when you'll compare with it picture with the sketch, you'll really enjoy it. Okay, so this is endocrine gland, right? When we say endocrine gland, that means it will be releasing its secretion into the blood, right? Otherwise, other glands, say for example, pancreatic gland, so it releases those pancreatic juices into a duct, and that duct goes into some of the organ. Over here, it will be releasing it into the blood. What it really does, this gland is so important because it will be handling water and electrolyte balance. So it means that in case if anything happens and if this balance is disturbed, straight away it will start affecting the muscle It will start affecting function of the organs. So exactly like that, if someone is dehydrated, right, if there is salt loss, so then what really happens, that muscle, the power of the muscle, it decreases. That is like if you run 30 kilometers, after that imagine what's the halat, right? It is so bad. So it is there where these systems will come into picture. So another very important thing, this is the gland which prepares the body for emergency, right? It prepares the body for emergency. That is what is indirectly we are talking about sympathetic system, right? Because it prepares the body for emergency. And that is fight, fright, or flight, right? When you want to fight, when you want to hit someone, when someone is afraid of you, right? Or when it is decided that there is no fun in staying over here, let's run away. So that is flight, right? That is when the person flees. In all these cases, it is the sympathetic nervous system which comes into picture. Yeah, chromaffin simply means that this is comprising of, as such, I'll be explaining again, but because you asked, these are the chromaffin cells which are sensitive to chromic acid, right? So that's why this system is called as the chromaffin cells. We'll actually watch the histology part of it. Regarding thorax, I got so many opinions that yes, because there are lots of, we have covered. Guys, can you see? Can you really see me? Because over here it is showing me some error. Uh, can you see me? Can you see me? Because I was surprised. Okay. So all good, because over here I have been I'm getting a message. Chalo, fine. As far as you can see, because all right. And whatever I'm writing, that also is all good, right? No problem. All good. Very fine. Just if you get any message, anything, right, just let me know immediately, because I'm getting some error over here. All good. Fine. So let's start. Let's start. Because in last 2 days, there were some very bad experiences. Seriously. Visible, audible too. Good, good, good. So preparing the body for emergency. In other words, we are talking about sympathetic nervous system, right? So that this gland is very important for that. Whenever there is any of the abnormality, right, it can occur in two ways. Either this particular gland is not functioning, so that is hypo, it is functioning less, or this gland becomes over enthusiastic and it starts functioning more. There can be several reasons: congenital, traumatic, inflammatory, neoplastic, miscellaneous, right? Everything, whether there is any tumor, whether there is any infection, whether there is any inflammation, whether there is any injury, all those things, anyhow, they just trigger, right? They pinch this gland, okay, come on, secrete, and then it results into so many problems. Why should it really occur? Why this gland can be so important in all those things? First, let's see where exactly it is located. Simply, it is located in epigastrium, right? So that is just a 5 minute of small theory, right? Epigastrium sitting on the head of kidneys. The right side, right? Will always write it so that it is easy to remember. This right side is triangular, right? And this left side, that is the left renal, is lunar, right? L for lunar, and this right side is triangular, right? No doubt, semilunar. But It's okay if we remember it like lunar, right? These are into posterior abdominal wall, right? Makes sense because kidneys, they themselves are the into the posterior abdominal wall. So posterior, right? Just behind. And in front, there are crus of diaphragm, right? So everywhere there is diaphragm, and then they are deeply seated structures. Weight of these kidneys, these adrenals, very less, just 5 grams, right? Very small, but vital, very important. So size is by 5 by 3 by 1 centimeters. So it means it's a small structure, but important. Now let's see that what exactly is the importance of this. Now in this will be like going for some physiology, some pharmacology, some, right, it will be all mixed up things, but for the clarity. So here is a cross section. We take a cross section and we immediately see that it can be divided into two parts, right? One, outer, and second one is inner, right? This is outer. So that's what is called as the cortex. Now see, interestingly, right? After today, you never ever have to cram anything. Everything is so musical in this case. See O, right? All curves. C, all curves, right? And it secretes what? It secretes steroidal hormones, right? Steroidal hormones. So again, a curve. Good. Okay. Now, how about on the this inner? Well, inner is medulla. Everything straight. Medulla. What it secretes? Well, it secretes adrenaline. Again, right? Adrenaline. Well, one more thing. Noradrenaline. Again, it is like this. Noradrenaline. Right? What's the other name of adrenaline? Epinephrine. Okay, again, E, right? Epinephrine. Noradrenaline, well, it is norepinephrine. So in all these cases, everything is with those straight lines. So now onwards, we'll never miss this thing that it is the medulla would be secreting what? It would be secreting adrenaline, noradrenaline. It is inner, everything fine, right? So here it is. Here it is. That's inner. Remember is this. Now, as soon as you'll watch this, immediately it will create that visual impression and you'll be able to revise much faster, right? So that's the thing. And over here, yes, this is outer. That's the cortex that secretes the steroids, right? Now, these two parts, they are completely different. Completely. They are completely different from the functional point of view, development point of view, everything completely different. We need to add one word over here, that this adrenaline, noradrenaline, you'll find that they are also called as the catecholamines. So they are amines, right? So again, A, they are amines, right? Cat drinking Coca-Cola. So they are catecholamines. And that's where it will be affecting the entire nervous system, right? This is where the fight, fright, and the flight response is handled, preparing ourselves for emergency, right? Everything, see, all straight lines, right? All straight lines. Good? Completely clear? Okay. Now I'll take you to a very quick, short journey on, say, this ANS, autonomic nervous system, right? We have autonomic nervous system. We divide it into, say, parasympathetic. Parasympathetic is rest and digest, right? So rest and digest. And today we are not dealing with it, so we'll not be talking much about it. We are interested in sympathetic because our today's guest of honor is a sympathetic organ, right? So here the journey starts all the way from hypothalamus, right? From the brain. Now, before we start with brain, see there are you know about this neurons, right? Those neurons. These are the cell bodies. So when there are group of cell bodies, and if they are inside, so then they are called as nucleus. And when they are outside the brain or spinal cord, they are called as the ganglion, right? There at times there is so much of confusion. So no worries. Just remember, like group of cell bodies, right? Their function that remains the same. They are the group of cell bodies. If they are inside the brain, so we call them nucleus, right? So that's why when we'll be studying brain, there would be lots and lots of nucleus. But when we are outside, so then we call them ganglia, right? Or the ganglion, right? So from hypothalamus, right? From hypothalamus starts the journey. Those fibers, they travel, right? Almost 4 to 5 feet long journey. As they come into spinal cord, they start giving the branches, right? So tuck, 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 right here. Now they are giving. Now still we are in spinal cord. Remember, we are in spinal cord, right? So in spinal cord, there would be relay stations. Relay stations, no big thing, where the signals would be passed on to another set of nerves, right? Fibers. But see, they are within the spinal cord. So let's make the spinal cord this thick, right? That's our spinal cord. So when we are inside the spinal cord, what would we tell to them? We'll say these are spinal cord nucleus, right? Because we said just now, we said that, well, if they are inside, they are nucleus. So spinal cord nucleus. For the sympathetic, it is also called as the thoracolumbar. So it would start from T1 to all the way to L2, right? From T1 to L2, from the middle. Now from here, the most interesting part of the entire system starts. And that is these fibers, they come out. Now, these innocent fibers, they are not knowing anything. So they say we need to go somewhere. And that is where first comes the preganglionic neural bodies. Preganglionic, right? So what exactly are these preganglionic and postganglionic? It goes something like this. From here, there are two sets, right? Actually, there are two sets. So all these, they will be arranging, right? Just after this is a short journey. And over here, they'll find, yes, there are ganglions all the way. And then they are connected with all those nerves, right? A very, very fancy thing, as if it is like that pearl necklace, right? A very fine thing. Today we'll watch this. Yeah, today we'll watch this. So these are those ganglia, right, which are called as they are just near the vertebra. So we'll call them paravertebral, right? Very easy name, right? Paravertebral ganglia. And this entire thing is called as that is what is called as the sympathetic chain, right? So actually, when we'll see that sympathetic chain in our dissection, it is not that complex, right? It is not that complex. This is what it is. This paravertebral ganglia, those who are arranged, they are just near to the spinal cord, and that's why over here these are all short fibers. Obviously, have to be, because immediately they are landing onto this paravertebral ganglia. And this is synapse, right? You know the synapse, right? Okay. Now from here, it is not so that journey ends at this point. From here, things would continue. And that is where the second set will be coming. So some of the fibers, in fact, many of the fibers, right? They are like they will just bypass. They will just bypass. They will not land over here. They'll just bypass, right? And they will continue. And they will continue to those ganglia which are bit far, right? Those who are bit far, so we'll call them collectively, we'll call them, these were pre, so they were para. And these were para, so these will be pre-vertebral, right? Pre-vertebral, before vertebra. Vertebra is far. So these are pre-vertebral ganglia. Now, you know these pre-vertebral ganglia very well. Yes, you know them very, very well. Why? Because all these pre-vertebral ganglia are 1, 2, and 3. And the moment I'll write first name, celiac, I know you'll be writing two names immediately, superior mesenteric and inferior mesenteric ganglia, right? Celiac ganglia, that is near aorta. It has to be, because that's from where that celiac trunk was arising. Superior mesenteric ganglia, obviously it will be near superior mesenteric artery, and the inferior mesenteric, what's the big rocket science in that, right? So that is, and from here starts the journey for the organs, specific organs. And these organs, you know them very well. Who will be supplying who, right? Yes, you know that. So the entire foregut, midgut, hindgut, yes, exactly. It goes like that. So simple as that. So the idea is that sympathetic chain, right? Celiac ganglia, superior mesenteric ganglia, inferior mesenteric ganglia, that's how they are arranged. And today we'll actually watch them, right? So that's why this brief discussion was taken into this account. Meantime, say this is one neuron, right? And it forms the synapse, right? And it goes over here. So this one is the ganglion. So this will be the preganglionic fiber, and this one would be the postganglionic fiber. Just for the conceptual thing, right? For the sympathetic fibers or the parasympathetic fibers, right? I'm trying to make it as simple as possible. Any of the fiber, sympathetic or parasympathetic, any of the system, the preganglionic neurotransmitter is always acetylcholine. It is always acetylcholine. The real fun starts in the postganglionic, because in sympathetic that would change, right? Because we just talked about that it was secreting that adrenaline. This acetylcholine is very shant, right? Is very decent. It is the adrenergic, right? That is what really is so aggressive. So this acetylcholine will be acting on whom? It will be acting on, do remember, one type of receptor, and that is called as the nicotinic receptor, right? It is called as the nicotinic receptor. We'll write receptor as R, nicotinic receptor. So then what are these receptors? Receptors are nothing but this is a receptor, right? It pinches, so then he does some action depending upon what type of person is, right? Now these nicotinic receptors, they are called as the ion channel receptors. Ion, right? So they are just interested in this sodium, potassium pump, etc. That's what they handle. So what they do, they will just pass on this message to the postganglionic fiber, and it goes. Now this postganglionic fiber, right, when they release their neurotransmitter, right, these are all neurotransmitter. That neurotransmitter, in case of sympathetic, is adrenaline or noradrenaline, right? They both work same. So that's why they are called as the adrenergic, also called as the catecholamines, right? Catecholamines, right? Catecholamines. And who will be, and they act on whom? They are aggressive, so they have got specific set of receptors, and they are called as the alpha and beta, right? Once again, there is subdivision also, like alpha 1, alpha 2, then beta 1, beta 2, beta 3, when actually we'll be discussing the physiology. I think I have already discussed this thing in one of the film, right? All these things, they are discussed in enormous detail, like say these are ion channels, or these alpha and beta receptors, they are GPCR, G protein coupled receptors. And when these receptors, they are stimulated, so what they do, they make some changes in the cell. They make actual changes in the cell. They affect metabolism, they affect cell division. So that's how these catecholamines, right, they will be making those changes in the cell, and that's how the entire body responds. Now, at this point of time, one more interesting thing, that see, some of the postganglionic fiber, right? We are talking about sympathetic. Now, this is a small piece which can be bit confusing, but understand it. We are not talking about parasympathetic, right? We'll talk about parasympathetic just after a minute. But this sympathetic, some of the postganglionic, right? Postganglionic fibers, right? Postganglionic fibers, they release acetylcholine, right? Every time it happens, I remember Paresh Rawal, right? That murgi, right? रहती वहाँ है, अंडा यहाँ देती है. Now these are sympathetic, but they give the anda of acetylcholine. Now this acetylcholine, it acts on muscarinic receptors, right? So when it is said that okay, there are two types of receptors in case of sympathetic system, right? That is alpha and beta. That is where the adrenergic receptors, adrenergic things will be acting. That is catecholamines. When it comes to cholinergic, that is acetylcholine. So we have got nicotinic receptor, which we already saw, that is ion channels, right? They handle just sodium potassium. Very seedha, sada, simple, right? Very uncomplicated. Bilkul simple. For the postganglionic, right, same neurotransmitter, but it acts on muscarinic receptors. Muscarinic receptors. Now these muscarinic receptors, they are real gundas, so that's why they start with G, right? That means they are G protein coupled receptors. It means if they are irritated, they'll make changes in the cell. Changes in the cell. So the point is, only few, right? There are only few such fibers which behaves like this. But as it is important to tell, so that's why I just took this point. Regarding the parasympathetic to is straight, right? This is preganglionic. So preganglionic, that is cholinergic, that means acetylcholine. It means it will be acting on what type of receptors? Yes, same as that, right? That means nicotinic receptors. And these nicotinic receptors, they are ion channel receptors. So they'll be handling sodium potassium pump. And then for the postganglionic, yes, because cholinergic, they understand only one language, right? And that is nicotinic and muscarinic. So over here, these are the muscarinic. And we just said that these are gundas, GPCR, so they make those changes in the cell. Changes in the cell. So the point is that see, everything is properly stationed, right? It is exactly like a very nice airport, nicely handled, and then you are sitting on the controls and you decide, okay, which flight will land on which runway. Exactly the same way, which neurotransmitter will be acting where for the desired effect. Fun becomes much better when you start using the drugs, and when you say that, okay, these are the beta receptor specific drugs, that means they won't be affecting alpha, and they will go pinpoint and they will start affecting beta. Still, you can be more specific that they'll be affecting beta 1 or beta 2 or beta 3. That's how you can be more and more specific. Advantage, you are targeting only one specific organ, and rest of the organs they are spared, right? Otherwise all those side effects they occur because of this, right? Because if one drug is acting on alpha and beta both, so you are trying to protect beta, but they will be going and irritating alpha also, right? And that's where the side effects start. This is what we'll be discussing at length when we'll be talking about pharmac. In pharmac, if with this concept, and plus we'll be discussing something more in just 1 or 2 sessions, right, which will be about this physiology, and then you understand the structure of the drug, and then you see how easy it is, right? Immediately you will start telling, okay, these are the side effects which are expected, these are the molecules which are bigger, they are bigger, so they cannot cross the blood brain barrier, bindas, no problems, they will not go into the brain. They can't cross the placental barrier, so nothing would happen to the baby, no problems, right? So only few concepts are there, and once you understand, rest of the pharmac is so easy and it's a pleasure, right? Okay, so from this point, still one mystery remains. Where is this adrenal sitting into this entire picture? Why we talked about it? And that is, say, as we said that adrenals, in adrenals it was like cortex and medulla. Cortex, so we have not yet touched, right? It is superbly interesting. Regarding this medulla, this adrenal medulla is somewhere, is something which is like an interface. It is interface. I couldn't figure out a better word because say in IT what happens is, that is when you are using your cell phone, so on your display what it is shown is called as the UI, user interface. So you actually just touch one area, right, and that's say that is for your email or that is for the WhatsApp, and you just touch that area, and then entire process of WhatsApp, it gets activated, and that software gets activated and starts showing the screen. So over here also, this adrenal medulla is the point where you touch it, and it will be the interface or the link between neural and the endocrine system. This is that important because it is like a link between both of them. Why? Endocrine system, it means it will be releasing adrenaline, noradrenaline directly into the blood. And when it is released into the blood, absolutely right, Priti. Absolutely right. Because in asthma, and then which drug to use, right? So that itself is a superb topic. Very true. So I was telling, yeah. So in endocrine, that's blood. In blood, all those catecholamines they are released, right? But who tells this adrenal that okay, you secrete or you don't secrete or stop? That is where now the fun starts. Those postganglionic fibers, you remember? Those postganglionic fibers, those fibers which were near the vertebra, that paravertebral sympathetic chain, and these smart fibers they bypassed those fibers, right? Bypassed, and then they ditched even other ganglia and they reached all the way to adrenal medulla. And then this adrenal medulla welcomes those fibers because this medulla now behaves like a modified sympathetic ganglia. So how smart this this adrenal medulla is. Adrenal medulla is under direct control. So all the way those fibers they were coming from hypothalamus. So hypothalamus will be telling that, okay, let's give supari to this adrenal medulla, and then this adrenal medulla takes that supari, right, and sends his all this steam and then executes the action, right? So that's how the things go. And that's what is called as the neural interface, because in this neurotransmitters are involved, right? These neurotransmitters were pre-ganglionic, post-ganglionic, that is all those cholinergic and acetylcholine, everything. And then on top of it, this medulla himself is releasing adrenaline and noradrenaline. That means it is neural as well as endocrine, and that's why this is like a modified sympathetic ganglia. And that's the best part of it, because its entire activity, right, its entire activity is superbly regulated by direct neural input, right, centrally, right? So it is by direct neural input. So this makes this gland so special, right? As such, it is of just 5 grams, but still so important. Now, how can we really ignore cortex? Because this cortex is now really sad. We are talking about medulla, right? So let me add one more page. Right? It'll take a minute. No problem. We'll watch that image in a minute. So here is our cortex, right? Should not feel bad, this cortex. And it is outer. What it does, it secretes, well, you will say it secretes those steroids, right? Secretes those steroids. There are 3 zones, right? And they are called as zona. Remember G, F, R, right? Near the kidney, so glomerular filtration rate, so that way we can even remember it. But there is still more better thing. It is called as the zona glomerulosa. Right? What it will do, right? Do it like this. These are glowing, right? These are like glowing minerals, right? Imagine nicely glowing minerals. It releases mineralocorticoids. Because all of them are steroids, so corticoids word will keep on coming. Corticoids, mineralocorticoids. Mineralo means they will be handling minerals, right? Obviously not gold and silver, right? But they will be handling salt and water. So important, right? They will be handling salt and water. So if they work more, they'll be over enthusiasm and they'll keep on throwing more salt and water. If they are working less, so it will accumulate. That's the reason that in case if anything happens to them, so either there would be edema, right? Accumulation of water. Water is not getting thrown out because these glomerulasa, they are not functioning properly. So do remember glowing minerals. So that means glomerulosa is for mineralocorticoids. Okay. Second is fasciculator, right? Quite a fancy name, right? Fancy name. And so I'll remember it like fancy glucose. As such, glucose is a very stylish thing, right? You know about the diabetes, such a stylish thing, right? Royal disease. So this is what releases glucocorticoids is common. Corticoids. So remember, fasciculator is for glucocorticoids. So this is what will lead to all those neoglucogenesis in liver, right? All those things, right? Again, a huge topic, but I'll just write neoglucogenesis. near this neoglucogenesis in liver as such, it is vital thing. Huh? Say, I'll explain in brief. We do have time. That for a patient, only the fasting is high. For rest of the things are quite okay. So this would be like a neoglucogenesis. It is because steroids, they have got a very heavy effect, and it is the liver which will keep on producing those glucose from other sources and will lead to high fasting sugar. Right? The third one is zona reticularis. Now, what to do? Say, if you actually Google, right, it is true that that say there is a Hindu goddess called Rati, right? Now she is a Hindu goddess. Now this Hindu goddess, she is a Hindu goddess for intimate pleasure, love, passion, right? So that's the goddess, right? For love, passion, and it is the zona reticularis very sensibly would release sex hormones. So these things, so they are very easy to remember, right? Glomerulosa, mineralocorticoids, glowing minerals, fancy glucose, that is fasciculata glucocorticoids, and the zona reticularis, right? That is all these sex hormones. That's the reason that it is such a fancy gland. Now, a short explanation of this. This is kidney, right? That's where the kidney is. On top of it, there is suprarenal gland. There is diaphragmatic fascia which is covering, all right, but it is open. This space is open. This space is open, right? This space is open. So it has to be in continuity with something, right? Because over here, over here in between all those tissues, right? Areolar tissues, they are there, right? Okay, we'll talk about it, right? Because we'll deviate completely from the topic. So over here there is, right, areolar tissue, right and left, right? So the head of this adrenal gland is open, so that has to be in connection with someone. So over here on the right side, it is just the bare area of liver, right? Bare area, nahi, bare area of liver, right? That is over there. And regarding the left, it is just under the diaphragm, so it is subphrenic. It's just over there, subphrenic space, right? Obviously, extra peritoneal, right? These are extra peritoneal. So that's the important point, that above space that is open. Okay. Some say differences. We'll go through that pyramidal, and that was lunar or semilunar, and we talked about that is the apex bare area of liver, and base is obviously they are sitting on the head of kidney, so upper kidney. Anterior surface, infravena cava and bare area of liver, okay. Posterior surface, diaphragm, right, and the kidney. And anterior border, that presents hilum and right vein. Don't worry about the vein, we'll actually see them. Medial border, celiac ganglion, this is worth remembering, and lateral border, liver. Over here again, upper end, that is close to spleen, right? This lower end is present hilum, left vein, we'll see this. And all the structures, that is stomach, pancreas, splenic artery, left truss of diaphragm, left kidney, all are arranged over there. Celiac ganglia, and the lateral border is on stomach. The point is, one, there is celiac ganglia. Regarding the blood supply, don't worry, we'll watch it very precisely. right? Once you'll see that, you'll be able to remember it easily. Here comes the first image, right? All those controversial, so-called controversial images. I don't know. So over here, this is left, right? This is the left. So that's the left kidney. And that's our organ, right? This is suprarenal. Suprarenal. Here is that's the aorta. This one. Oh, sorry. This one. That's aorta. So if you say this is aorta, then this first opening, it has to be celiac. You are right, right? Because there is no other branch. If it is celiac, then immediately below it, right, next to it, superior mesenteric artery, perfect, and still below there will be inferior mesenteric, right? Aorta is posterior, right? The emergence of superior mesenteric artery, right? Right? That is over here. It is at the level, and in front, this is left renal vein, because veins, they are in front, right? So that is left renal vein. And what is this? This is like renal pelvis, which goes into this, the ureter. So far, things are crystal clear, right? Okay. I am interested in this because this was about kidney. We are not discussing kidney today. We are talking about this. I'm just highlighting it so that you can see, appreciate it properly. Yes, now it is okay. That is left suprarenal vein, right? This is left suprarenal vein. Keep in mind that where exactly it is landing onto left renal vein, correct? It is landing onto left renal vein in case of left side. That's the point which you'll remember. Moving further. Now this is right side. Right. Now over here we are watching it from that was the anterior view, right? This one is anterior view. Now this is right side. And we are watching posteriorly. This is posterior view. Things which are immediately clear, we don't have to even write. This is ureter, kidney, all other structures, they are quite okay. There is, can you see those arteries over here? That's what I wanted to show you over here. All those arteries, suprarenal arteries, such a vascular structure, right? So suprarenal arteries. But they are not one. There are so many. And this one is right renal artery. The only purpose is just to emphasize arteries, they are behind, veins, they are in front. Right? Okay. Quickly, apex, yes, that's the lateral border, makes sense. That would be the anterior surface, right? We are dealing with the right suprarenal gland, and this is anterior. So area related to inferior vena cava, okay, area related to liver, and that's called as the base because this is pyramidal structure, and that's the anterior surface of right kidney. Okay, now this is for the left kidney, right? left kidney, and again the anterior surface. Some obvious things. This is the upper end. That's okay. This is where it will be related to stomach, pancreas, right? That's the anterior surface, upper end, lower end. It's all good. All you need to remember is that it was the pancreas which was going like this, and then there was spleen, right? And then there was lino renal and all those splenic ligaments, all those, they were there. True. So that's how things are associated. Now comes our best part. See this. This is a conceptual thing. Just a minute. A very conceptual thing. Orient yourself properly. We are watching left kidney and suprarenal, right? Left kidney and suprarenal. So where are they? Here it is. This one is left suprarenal, and this one is left kidney. So if it is kidney, that means veins will be in front, first thing first, right? Roots of a plant. That's right. Even see, actually, see, first time when I saw, I also felt like that. Okay. Now let's see something so sensational. That you remember that sympathetic trunk? This is that. This one, right? See, it's not that chota, that simple. It is quite complex, and once we remove here, there is like a whole jungle, and that jungle continues all the way up to here. This is also sympathetic plexus. So I'm just writing S star and S star, and this S star is sympathetic plexus. When I first used to see all these things now, say I do have telescope. So in book you see, okay, this is Alpha Centauri, our nearest star, which is like say 3.7, 3.45 light years far. And when you see that star, right, it gives so much of pleasure. Actually, when you see those Saturn rings, though they look so small, but when you really see it in books, so yes, they are like big images. But actually, when you see it on your telescope, it is such a pleasure. Same thing is over here. When you know that, okay, this is sympathetic trunk, right? How beautiful. And now entire system runs in your mind. So this is that sympathetic trunk. That's first thing which I wanted to emphasize on. The second, there is huge big aorta sitting over here, and this is the monstrous, because this is such a close-up, right? So this is the monstrous aorta all the way. That's the aorta, right? If I really highlight it, right, then we'll remove it. But this is aorta. That's the aorta, right? Though it is behind, right? But that's the aorta, this big, right? Now I'll remove it because we want to see that from aorta, near the aorta, we talked about celiac ganglion, right? So where is that celiac ganglion? Here is the celiac ganglion. That's celiac ganglion. This one, that is celiac ganglion. So it has to be near what? It has to be near celiac trunk, right? So that's the celiac trunk. And from celiac trunk, this one big artery which is trying to go towards the left side, and it is, as such, we have cut it, but it is highly tortuous. I know, that is splenic artery. Fine. So that is splenic artery. Still more mysteries are over here. The best part is yet to come. And that part is, can you really identify a structure which we have cut it like this? Can you see it? Right? So nicely it is seen. The structure which is coming out at the level of renal artery. The structure which is coming out from the aorta at the level of renal artery. Remember the words, right? Now I'll remove it, and can you appreciate that structure? See, now it is seen, right? Suddenly we find, yes, it is seen, right? So this is superior mesenteric artery. If this is superior mesenteric artery, that means there has to be the artery, renal artery, left renal artery somewhere near. But these are veins. These are veins outside. All these are veins, right? Where is artery? That in between this one, that is the left renal artery. Now all those veins, they are feeling so bad, right? But doesn't matter, right? We need to remember our old friend, and that's the muscle. And this muscle needs no introduction, and it is psoas major. Excellent. Right? Now comes this group 1, 2, 3, 4. Now, before we study this particular thing, that is 1, 2, 3, and 4. And okay, this is ureter. Okay? So that is done. But regarding this 1, 2, 3, 4, we won't touch it right now. We'll come back in a minute, so that we really appreciate the beauty of this structure, that how nicely they are, and so much to learn from it. So celiac ganglion, right, aorta, supramesenteric, psoas major, ureter, left renal artery, left kidney, left suprarenal, and sympathetic chain, all good. So this is good, you are making that group. Achha. We'll see this. Before that, yeah, watch this. This is the figure. This is something which I'm telling. Draw 2, 3 times, so that you remember it very, very crisply. It is symmetric, so no worries. Veins are not like that. So over here, it is a highly vascular system, right? So inferior phrenic artery, you remember? Inferior phrenic artery, we studied that as soon as the aorta lands, it comes into the abdomen, the first thing it gives is, right, so sincerely, the diaphragm is over here, so it gives these arteries to diaphragm, that is inferior phrenic artery. This inferior phrenic artery is a good hearted artery, and it supplies one branch to this highly demanding suprarenal, right? So this is the first, superior suprarenal. It has to be superior. Names are so easy. Superior suprarenal, middle suprarenal, and this is inferior suprarenal. It's not written over here. No problem. Here it is. Inferior suprarenal. So we have superior, middle, and inferior. Superior, middle, and inferior, right? They both are absolutely symmetrical. Simple. Here is the superior suprarenal from inferior phrenic, done. Middle suprarenal directly from the grace of aorta, right? So this is also done too. And this third one, that is the inferior suprarenal, right? It is the branch of renal arteries. So renal arteries, they take this responsibility. So whosoever is near supplies, because this is a highly vascular system, so it is necessary to take the blood from this, because that blood would be loaded with all those neurotransmitters, right? So rest is all abdominal aorta, renal artery, all good. That is simple. So just we have to remember this part: superior suprarenal, middle suprarenal, and the inferior suprarenal. If you draw it 2-3 times, right, it will be set in your brain, and it is necessary, can be asked, and is asked very frequently. More important, coming up is vein. For the vein, things are a bit tricky, and that's what we'll be watching. Going back to that figure, that's IVC, right? This is inferior vena cava. Inferior vena cava, and these are the tributaries, right? So it is this left and the right renal veins, they are draining into IVC. So kidneys, they will be here, correct? Kidneys, they will be here. So we have got left suprarenal vein. This is just one. And this left gonadal vein, that is landing into the left renal vein. Got it? Now in real dissection, there is a slight variation. So that's why I'm showing you this part first. So if we really draw, it is simply like, just like this, right? This is left renal vein, obviously all vein. This is left, on all are left. So gonadal vein, and over here, this is the suprarenal vein, right? Nothing middle, superior, inferior, just one suprarenal vein. But over here, say in kidney, it divides, right? In fact, these two unite to form the left renal vein. And this suprarenal is part of it, and gonadal will be draining into it. So thus this is like a joint venture. Finally, they go into the inferior vena cava. This is how the theory goes. In reality, there is so much of variation. Let's see it. And it is fun. You'll be able to identify, okay, psoas major, because you know, so I just take him, that arrow, I take him from here. Okay, this is psoas major. This one, no doubt from the direction itself, right? This is left gonadal vein. Where was it landing? It was landing into left renal vein. Well, here it is. This is left renal, this is left renal, and then they join, and here they form actually the left renal vein. So this is where it goes into its one of the tributaries, and then it will go for the final destination. Similarly, this is suprarenal, right? Left suprarenal. And this one would be just lonely suprarenal, right? The left suprarenal vein. But see how khudar it is. It will say, no, I'll drain directly all the way onto that source, right? So straight away it goes to this final part of that left renal vein. And from there, straight away, they will be going into the inferior vena cava. So that's the thing, that at times you will find some variations, right? Now see, this is another cross section just for the concept, right? So over here, this one would be, say, kidney, right? And this is like a right kidney. And when the section is taken, so kidneys, they always lie on that muscle. So this is our psoas major, right? That's the psoas major. And in between this, what you were watching, this part, that is what is called as the renal fascia, right? That is renal fascia. And surrounding the kidney, right? This is what is called as the fat, and it is called as the perirenal fat, right? So this is perirenal fat. Rest all the structures, right? This is like a big muscle, quadratus lumborum, all those back muscles, right? Quadratus lumborum, and the coverings. right? This entire thing, that is the renal capsule, right? It is the renal capsule. Renal capsule. Okay, one more image, right? And at the end of this, right, I have kept all these three images absolutely neat. So over here, so I'll write, but those images you can utilize for your practice part, right? Now this is a very conceptual image, right? So very conceptual. Understand it very nicely, because after that there is just very few things which are left out. So here it is. This is IVC, inferior vena cava, right? That makes sense because it is right in front. So this one would be left renal vein, right? So and on the opposite side, right, that would be the, this one would be the right renal vein. All right, right renal vein is short, right, left renal vein is long. You know the reason. On front, this is superior mesenteric artery, correct? Superior mesenteric artery, which is right over there. And see over here, who is she? This is that left gonadal vein, correct? Left gonadal vein, testicular or ovarian, male or female. And here is that chupa hua, that is ureter, right? Left ureter, obviously. And this left gonadal vein will be landing into right, that is this all the way left renal vein. That left renal vein, that is what is going into IVC. So good. Where is our suprarenal? Here is, that smarty is here, right? That's suprarenal. So this is our suprarenal. So suprarenal, so there has to be one vein only, and that is straight away diving deep. And this one would be left suprarenal vein. Right? All these veins are good, just one vein enough. Right? All good. Right? This side, this is the right suprarenal. Correct? And then just behind the inferior vena cava, because from aorta those renal vessels they come out, right? But those renal arteries, right, just from behind the IVC there is aorta, and from there the renal arteries are coming out. So these renal arteries, here are the renal artery, and see how it divides, right? And that's like ureter, and it is lying comfortably on our, say, this psoas major. All good, right? Properly oriented. And look at the caliber, look at the bore of the IVC, how big it is as it goes up, right? So that's it. Kidneys I have not marked because I don't want to insult your intelligence, right? Okay, this is interesting. That's the reason the disclaimer was there. This is laparoscopic view. Let me write here, laparoscopic view, right? Orient yourself a bit, that how exactly are we watching, what are we watching? This is right kidney, because when we watch the things in cadaver, right, at times it is not that appealing, though it looks thrilling, but not that appealing. This is like real tissue, right kidney. And then see, this one is right renal artery, and all these which are gracefully coming out, right, that is right renal vein, right? And why we have included him this, because our guest of honor is sitting over here. See how nice, right? That is right suprarenal. Enough. So we saw this. Okay. For the lymphatic drainage, again, very simple. Aorta is passing nearby, so everything should be drained into lateral aortic nodes. Khatam. Done. Right? Everything, it goes over there. You will find that because this gland is so important, if its remnants, even if it's some pieces, right, they are spreading here or there, then when it is not found at its correct location, so they are called as the accessory glands. So accessory suprarenal glands, they can prove really dangerous because you have done adrenalectomy, you have removed the adrenals because this was like a case of carcinoma of breast and RT was not advisable, and it was like an hormonal dependent tumor, and it was necessary that if we remove these adrenals, so then it would be really necessary. You remove the adrenals and still the patient is not getting good. Reason, those accessory suprarenal glands, they were sitting over there and they were secreting all those hormones, sex hormones, right? So where can be? They can be near in the spermatic cord, right? They can be into that epididymis, right? They can be into that broad ligament of uterus, yeah, uterus broad ligament. So all these areas, right, they are the potential sites for accessory suprarenals. Regarding the nerve supply, right, again, as promised, that we'll be discussing the nerve supply, that is all those plexuses at length. But from this perspective, we know two parts. One, that medulla, right, medulla, that is from preganglionic sympathetic fibers, right? This is from myelinated, those fibers which were not literally bypassing all those neurons and then landing straight away. So they are from myelinated preganglionic fibers, and they were landing all the way over here into the medulla, right? And also, when we said that chromaffin cells, right, because they are similar to those sympathetic neurons, right? So chromaffin cells, they have got the chromaffin cells, and when we'll see the histology, we'll see that chromaffin cells, they are very similar to sympathetic neurons, because this gland would behave like that. See, here it is, right? Long awaited this histology, right? So capsule, fair enough. That's our zona glomerulosa. Glomerulus are glowing minerals. Yes, it releases mineralocorticoids, right? See how confidently then you can really say. And to add to this, these are like columnar cells, right? So we'll just draw, we'll not write. These are all columnar cells. Columnar cells are, they are good in height. And they are with round nucleus, which is at the base, right? So that's how they look like. This much drawing is more than enough. Second is what? Zona fasciculator, right? Fancy glucose. So they release glucocorticoids, right? And these are, see how the classical pattern. We'll just do like this and we'll write vertical. They are vertically arranged cells. If you speak this much, that cells are arranged in vertical rows, that's more than enough. So how zona glomerulosa look like? They are columnar cells with big round nucleus. Done. How about zona fasciculata? Well, these are the cells which are arranged in the vertical rows, right? And they are quite loose, less packed. Yeah, it looks like, right? See, here they are dense, right? Here they are like enjoying free space. Okay, so that is zona fasciculator. And the third one, right? Zona reticularis, I know, you know it, right? These are quite cozy, right? So they are packed, right? Makes sense, right? Easy to remember, right? So these are the, and then they do lots of anastomosing, right? So symbolic, right? So I'll just write lots of anastomosing, anastomosing. So that's why it makes it so rich. Fine. So all these three done. So finally, we land into the medulla. Medulla is over here, right? And it is this medulla which is similar to where we see these sympathetic ganglion cells, right? These are the sympathetic ganglion cells. That's how it looks like. So pretty easy histology and quite symbolic. Regarding the chromaffin system, right? When you say okay, why these are called as the chromaffin. Chromaffin means these cells, they have affinity, right? Affinity means special love for chromic acid, right? This is chromic acid. It is what is called as the affinity. There is one more name, and you must remember this name. This is called as the pheochromocytes. Because when there would be tumors, it would be like pheochromocytoma. So indication is from this name, right? And these cells, they are located close to sympathetic ganglia, right? So we'll just write sympathetic ganglia, right? They are near to it. Now see, we said that this system, that is chromaffin system, it is like suprarenal medulla, paraganglia, there are aortic bodies, right? So many other structures. All those will come when we'll be talking about the plexus, when we'll be learning about splanchnic nerve, so that it will make a complete sense, right? So that's why there are few plexuses which will be coming, but right now we are not talking about it. Coming to this final part, the cortex, right? The cortex. When it decreases in size, so it is what is called as the atrophy. Simple, right? Say for example, in any of the infections, say for example, tuberculosis, right? Tuberculosis, it is decreased in its function and size. Yes, I'll do that because I missed that, but I will manage it. Okay, so cortex, so this is atrophy. Once it is atrophied, what would happen? Cortical secretion would decrease, right? Cortical secretion would decrease. Now when the cortical secretion drops, now you know it so effectively, right? What it was doing, right? Adrenal cortex and the medulla. Cortex was the GFR, है ना? So that means when those this zona glomerulosa, that is, which was releasing those mineralocorticoids, when they are affected, it means mineralocorticoids then when are affected, it will start affecting first. It will lead to muscular weakness, right? Simply. Salts, blood pressure would be affected, might drop, right? Anemia. See, so important thing. There would be all those skin pigmentations, right? And finally, because the kidneys, they are taking the entire load, may lead to renal failure. Everything because that cortex is now not functioning, right? And collectively, such thing, when there is atrophy, this thing is actually called as the Addison's disease. So I would remember this as Addison is for atrophy, right? Addison for atrophy. And when atrophy occurs, all those symptoms, yes, in medicine, every symptom would be discussed in extensive detail, but this is just to give you an overview that what can really happen. So now in second, we saw that cortex was not atrophied. What if it becomes big? Hyperplasia. Right now, this cortex will become over enthusiastic, and it will start lead to increased cortical secretion. Right now, when the secretions are increased, disease depends that which secretion is increasing. Right. Okay. So increased glucocorticoids. Let's say that is what is happening. If that happens, right, it will lead to that obesity. It is also called as hirsutism, hairs. Excessive hairs will lead to diabetes, right? Will lead to hypogonadism. Because see, when the minerals, right, when this is like it is functioning excessively, and this thing is collectively called as Cushing syndrome. Cushing syndrome. So over here, even if you don't remember all the sign symptoms, doesn't matter, but you just remember that what is really happening. Say increased glucocorticoids, right? That is what is happening in this case. Now, what about those XEX hormones? The trouble is when it becomes reverse. In case of female, right, when there is increased production of androgens, testosterone. So over here, it will lead to masculinization, right? Female will become very muscular, so will go towards male side. And over here, in case of males, right? So when there will be more estrogens, so there would be feminization. So just do remember that it depends upon what really is happening at what level, right? In children, it can occur even in early age. That is what is called as the adrenogenital syndrome. In case of males, right, there is excessive development. Right, there would be excessive development of gonads. And in case of females, right, it can lead to that pseudo hermaphroditism. It means that they carry characteristic of male as well as female, right? And as I said, that pheochromocytoma, right? This is chromocytoma. Pheochromocytoma is nothing but a benign tumor, right? This is a benign tumor of suprarenals, right? Of suprarenals. So over here, there is like hypertension, palpitation, headache, sweating, right? All those are symptoms. So we'll just write, say, increased blood pressure, palpitation, sweating, etc. Right? More when we'll meet in the class of medicine, right? So that's it for today. And see, at the end, I have put all those images for your practice, right? So that is that I put at the end. So thank you so much. And thank you again for the support. Thank you and bye-bye. I'm saving this file into our shared folder. Thank you. Regarding the thorax, we'll plan something. We'll definitely plan. But meantime, you can just have a look at all those sessions about the heart, right? Those sessions, they are there. So just at least go through it. Regarding the respiratory system, lungs, there are sessions. So if you'll go through it, it will make my work much easier. I don't mind taking few sessions so that we actually complete the thorax, right? No problems. We'll see that. Thank you and bye bye. Good night.